Hi, my name is Dr. Jerry Bagel, and I've spent the last generation of my life trying to help people with psoriasis. Psoriasis is a serious disease of the skin, which usually presents itself with plaques that are red and scaly all over the body, can be itchy, painful, and bleeding. In addition, people with psoriasis have metabolic syndromes, increase in obesity, diabetes, hyperlipidemia, which results in an increased frequency of cardiovascular events. What I mean by that is an increased frequency of heart attacks and strokes in people with psoriasis relative to people without psoriasis. There's still this stigma that people have with psoriasis that it could be dirty, that it could be contagious, that they feel like they're outcasts. And many times, in some ways, they are. They have diminished self-esteem, decreased in interpersonal dynamics, avoidance. They shy from the community. They won't go to the beach. They won't go to the hot tub. They'll minimize their social activity. Psoriasis affects about 2 to 3% of the American population, so there's about 7 million people that have psoriasis. About a third of them have moderate to severe psoriasis, meaning that it affects probably 5% or more of their body. It can occur spontaneously. It can occur very commonly after stress. The most devastating psoriasis I ever saw was about 3 months after Superstorm Sandy, where many people were displaced from their homes and lost work. And I saw extreme flares of psoriasis in people that I knew or some that I didn't know, had never seen before. Psoriasis is caused by an increase in the activity of the immune system in the skin. The skin, our largest organ, protects us. And in the process of protecting us from the outside world, the immune system has to play a role. In psoriasis, which is somewhat like an autoimmune disorder, there's an increased activity in the immune system that should not exist. And this increase in activity of the immune system, specifically helper T cells, produces chemicals that increase the proliferation of the epidermis, the upper layer of the skin. Normally, the epidermis takes 28 days to grow. In psoriasis, it takes 4. And since it's growing 7 times the rate of normal, it does not mature properly. Hence, it gets thick, it gets scaly, it gets rough, it gets red, it gets itchy. It's not normal. Fortunately, over the past 15 years, the development of biologic therapy, targeted treatment to the specific molecules in the immune system that induce the epidermis to proliferate, have been developed. We now have agents, relatively safe treatments that can clear people up within 12 weeks. For localized psoriasis, the common treatments would be topical steroids, topical vitamin D derivatives, extract laser, which is a localized ultraviolet B treatment. For more extensive treatments, we can use ultraviolet B light, not utilized as much as it was in the past because if you have psoriasis of the scalp, it's not going to help. The psoriasis in the scalp is not going to penetrate the hair. If you have joint involvement, psoriatic arthritis, it's not going to help that. So beyond that, there are really good biologic agents that are subcutaneous molecules that can be administered depending on the treatment, either every other week or once a month or once every 3 months, that can diminish psoriasis significantly. In addition, there's some oral medications that are available, not quite as effective, but quite safe. And there are many other new medications that are in development, specifically more oral medications that are now being developed that have higher efficacy than the ones in the past. For the best treatments we have today, I would say that there can be a 54% improvement within 4 weeks after one shot. I'd say within 12 weeks, there can be a 75% improvement. And within 16 weeks, there can be about 60% of people that are clear. The most common side effects of the newer medications are manageable by and large. Upper respiratory infections, nasopharyngitis, treated with some antibiotics. Those are the typical adverse events that we see with the newer biologic agents. We don't see an increase in malignancy, an increase in serious infections. I think in a person that's being evaluated by a dermatologist for psoriasis, they need to come in with their past medical history and also need to come in knowing what treatments they've had in the past, what's worked and what has not worked. I think those are the two most important factors that can help a dermatologist in determining what treatments is going to be effective for them. Windsor Dermatology is the home of the Psoriasis Treatment Center of Central New Jersey, which has been in existence for over 30 years, that is dedicated to the treatment of people with psoriasis and has been involved in over 200 clinical trials, has treated over 10,000 people with psoriasis, has a group of dermatologists and medical assistants and nurses that are involved in directly getting involved with people with psoriasis and helping them, most importantly, getting access to the treatment that they need. The most important aspect I would give somebody that's watching at home is find a dermatologist that likes to treat psoriasis. Find a dermatologist that knows how to get biologic agents accessible for you. Find a dermatologist whose staff is familiar with the treatment of psoriasis. We are focused on the treatment and improvement of the quality of life of people with psoriasis. Our goal is to make people with psoriasis live without thinking that they have it.